Over 270 episodes ago, I had on Dr. Sam Cope when he was a baby dentist. And he's unique because he's a physio who trained to then become a dentist. Back then, we discussed about back pain in dentistry and how to prevent it. And we talk a bit more about those themes today. Are ergo loupes worth it? Are those posh bam-back kind of chairs, are they worth it? What's the number one advice to have a career with longevity and good health from a back pain perspective? And as a physio come dentist, what does Sam do? What are the things that he practices? Because he's a bit like when Cristiano Ronaldo rejoined Manchester United. He was a big deal, right? He is the GOAT. He is the greatest of all time. I'm a Ronaldo fan. Anyway, when he was in the canteen of Manchester United, he was like eating with all other players. Everyone just looked at Ronaldo. What was on his plate? They wanted to model Ronaldo. So why do I mention that? Because I'm looking at Sam. Whatever Sam's doing with his posture, with his back, etc., I want to be doing that because he has the most knowledge. He is musculoskeletal with his physio background, and he's a really good dentist. So let's see what advice Sam has for us today. Now, after this episode, if you want to go deeper into back pain, chronic back pain, we've got Ben, a physio, and Sam, physio come dentist. That was PDP220, like I said, over 280 episodes ago. In fact, it will be good for you to revisit some of the older episodes to see my journey and the journey of Protrusive. Now they have team members and a whole production line to bring you all this content. And a special thanks for all of you that remember listening to that episode on Spotify all those years ago. There is some new information, applicable information, and Sam's no longer a baby dentist. He's really accelerated at a fast rate. So I made a big deal of at the beginning of this podcast to talk about his journey, because his journey really exemplifies the advice I give to every single young dentist. I get the question all the time: how do I structure my career? How do I grow at the fastest rate possible? How can I find the right clinic? How can I be doing more of the higher end dentistry? Well, Sam's playbook is there, and he shares it with us in this episode. So you'll get some career advice as always, plus how to get more longevity from your career. The protrusive dental pearl is a non-clinical one, and it's taken from this episode, and it's just something you already know, but it's just important to hear again, and that is: motion is lotion. Too many of my dentist friends are talking to me and saying that, I just don't have time to exercise, and I've really let myself go, or I'm not prioritizing it, and that is the wrong way to go. Your physical health and mental health is super important, but just focusing a little bit on the physical aspect, spoiler alert, that is the number one way to prevent back pain and to give you a career with longevity. And you'll hear later in this episode whether deadlifts are recommended or not, or what's the best type of exercise, but as long as exercise is part of your life. And for many of you, you guys are running or jogging when you're listening to the episode, and you guys are already living and breathing that, and more power to you. But so many of you in the car, on the train, and maybe the most exercise you get is when you're going upstairs and downstairs of your surgery, and you need to really reevaluate your life and your life decisions and how you may be neglecting your physical health. Again, it's stuff we already know, but one of the first dental pearls I ever shared with you, may actually have been number one and number two, was to know something and not actually do it is as good as not knowing it in the first place. So, Protrusive, I'm trying to look out for you here. Are you making time for physical exercise? Are you practicing motion is lotion? I hope you are, and if you're not, hoping this is going to give you the kick up the backside to make some sort of regime, some sort of promise to change that about yourself, because the reason you clicked onto this episode is because something piqued your interest about back pain and having a career with longevity. And if you're not even doing that, then you're losing out on so many benefits. Anyway, hope you enjoy the rest of this episode. I'll catch you in the outro. Dr. Sam Cope, welcome back again to the Protrusive Dental Podcast. So nice to see you and your growth and your journey, and to see you live at the Protrusive events on the app and doing wonderful things on social media, my friend. Welcome. How are you?
Yeah, thanks very much. And thanks for having me back on the podcast as well. It's a real honor. I've seen, because it was in the early stages that I was on last time, and it's really grown and kind of kicked off.
You were about 270 episodes ago, mate.
Wow. Yeah, crazy. I'm a dinosaur.
Well, honestly, you did so well then, but there's some unfinished business, right? The unfinished business is a little bit of a stir that we created. We talked about being no correlation between bad posture and back pain, okay? So we want to just talk a little bit about that, a little finer points about that, and also just revisit your journey from physio to dentistry, but now that you've been in the game for a bit longer, right? How do you feel? Do you have any regrets and that kind of stuff? And I hope you like the title of this podcast, My Neck, My Back, fix your posture while removing plaque. I just wanted to go in some sort of a funny theme. But Sam, for those who didn't listen to that episode, looking at back pain, it was two guests I had on at the same time. And so for those who haven't listened to that, please do check it out. But just remind us about your journey and where you practice today.
Yeah, so I started off, I did physiotherapy at King's from 2011 to 2014. And I actually I was on a course this weekend and met somebody that was there at the same time who was doing dentistry at the same time. And we were kind of reminiscing because we were in halls, and every time you'd go into the kitchen in Great Dover Street Apartments, which is where we were, you'd see the Shard being built a little bit more every time you went for breakfast. So yeah, so I started off at King's. I did physiotherapy, really enjoyed it. And after I finished physiotherapy, so when you do physio, you do respiratory, neurological physiotherapy, and musculoskeletal. The musculoskeletal element is the bit that most people know that physios do. And whenever somebody says, "Oh, are you a physio?" you'd say yes. And then they'll say, "How good are you at massages?" And you'd say, you'd roll your eyes and think, "Oh God." But yeah, we are actually pretty good at massages. I remember the very first, like when we got into physiotherapy, like their icebreaker, they just said, "Right, everybody get your tops off and then we're going to do some massage." And I was like, Jesus, here we go. Like, this is what's going to happen. But I did physiotherapy. That was really good. And then once I finished, I realized that there was a bit of a ceiling effect with musculoskeletal physiotherapy. So whilst I was doing physiotherapy at King's, I was also doing physiotherapy for the London Irish Gaelic football team and Millwall rugby team. And it was really cool because you'd be doing first aid on the pitch. But when the players are coming to you, they're coming to you because they need help, or because in almost like a negative way, because obviously it's their career almost at risk for them having to come and see you. Even though you are part of the team, I would have rather have been actually playing with them, like on the, being part of the team that way. Especially once I started musculoskeletal physiotherapy, if I really wanted to progress, I'd have to start being with a football team or something like that. And that comes with connotations in terms of it's difficult to have a family because you're flying around the world all the time. And I just thought, is this really for me? And then I looked at dentistry, and I had looked at dentistry for many years before. My uncle and granddad are both dentists. So I thought, do you know what? Actually, this is going to be the only chance I'm ever going to have to kind of do dentistry. So I luckily got on the 4-year program at Liverpool, did the 4 years of dentistry. I didn't leave the physiotherapy behind because I didn't want to be a poor student again. So I was doing physiotherapy Monday, Tuesday nights and Saturdays. And that was great because not only was I getting experience from the dental field, but I was also seeing a very diverse patient range, and I was doing quicker consults and examinations and learning about communication, which I think that's probably, 90% of dentistry, I'd say at the moment, is communication.
Well, I see you now in your evolution into private practice, doing aesthetic work. Everyone has to at some stage, those who wish to get over some imposter syndrome, get their communication gear, get their skills in gear, and then make that jump to private practice, should you wish for that to be part of your career. And I've seen you do that, and we can talk about that in the podcast. But I think your skills of the university of life in the real world, in your physio as you were studying, probably helped you being able to speak to people, get those reps in, so it serves you well later in your career. Would you agree with that?
Yeah, definitely. It's definitely helped. It helped me progress faster too. So I found that, so once I'd finished physio and dentistry, then I went on to do my foundation years. And then I went and worked at the dental house in Liverpool with Stuart Garton. He's a lovely guy. And I found there it was a little bit different. So when I was doing NHS dentistry, I'd have half an hour for my checkups so that you can sell more private dentistry, but there was a dental therapist model there where any fillings I would send, well, simple fillings or child extractions and things I could send to the dental therapist. So it meant that I built my skills more with preps, and also eventually going on to more, I could do preps, veneers, composite veneers and things. And the only way that I got confident doing that was in the early days, I'd be doing like 5-6 days a week. And on the days off, I would be shadowing different dentists, from like orthodontists. There were quite a few restorative dentists that were there as well. I'd be shadowing them. And you'd gain loads of techniques and you gain lots of communication. There's some things that are hard to do to communicate to patients, and sometimes you'll hear a clinician say something and you'll be like, wow, like they've just summarized maybe like 3 paragraphs of communication into about 3 sentences. So that was really, really helpful. And then I went on the postgraduate diploma then with Monic Vasant. I did the totally composite course first. And after that, I remember being on the train coming back thinking like, wow, that was the best course I've ever been on. And the reason was just because he's so charismatic. He's a good guy. And just the way that he can teach. When you finish a course, you want to feel like on Monday you can deliver that exact thing on a patient. And when you come back from a course, especially with the composite, you want to look at your model and think, wow, that's the best posterior composite or the best anterior composite that I've ever done. And that's what you get from a course like that. So I did his year-long course after that. He then must have been looking at my work, but he asked me to be his apprentice after that. So I worked as his apprentice for a while. And
what
then,
does that entail?
yeah.
Because this is new to me, right? So, you watch the show, The Apprentice, right? And you think, okay, this is what, or there's apprenticeships. So just delve into that model. And before you delve into that model, I just want to highlight something for those listening and watching, right? If you look at Sam's career and the way he's describing it, there's a few prominent themes that you should not go unnoticed, which is drive. You had the drive and the hunger, right? Who else? Okay, so I look at people, right? And they're like, oh yeah, I want to be successful. I want to be this kind of dentist. I want to do that kind of work. Okay. But then they're not putting the hours in. They're not as hungry, basically. They're choosing to spend their weekends watching Netflix rather than doing what you're doing, working 5-6 days a week and then also shadowing on top. Now, some people might say, you know what, that's obsessive. That's too much. But if you don't do it in your first 5 years, when are you going to do it? You're not going to do it when you have kids. You're not going to do it when some sort of health crisis happens later on. Because as you've learned, that can happen, right? So what I love about you is you had the drive and you played the season of life, my friend. You had that season. You got your reps in. You had mentors, not only the ones you shadowed, but the ones, the courses you went on. And you obviously had this wonderful thing about you that you connected with them. And then you opened yourself to allow Monic to take you under his wing. But just tell me now more about what does an apprenticeship look like nowadays?
Yeah, so I mean, it was very new to me and it was very new to Monic at the time. He'd taken Will on to start off with. And it was basically where I was helping him out on the course. So on the year-long course, I was helping him out on the course. And then as you got more confident, then you would do more things in the clinic.
So you're working in his clinic. So you're an associate of his, is that right?
You are salaried. So you're basically helping out on all his teaching courses. And then you're also seeing patients as well, maybe like once or twice a week. But the majority of it, just because of the sheer volume of courses that he's doing, he really needs you there to kind of help and kind of mentor some of the dentists. And you gain more experience from that than you would on a patient. And the reason is because, say, on the totally composite course, people are doing composite veneers. You've got 20, 30 people that are doing composite veneers that are making mistakes. You're going around fixing those mistakes, things that you'd think could never have even happened. And it's quite nerve-wracking because you've got to be confident enough to fix it in front of them. But it's very, very good because then, you've done that day, but it's almost like you've just completed, 20 separate composite veneer cases and you fix those mistakes. So then when you come into clinic and something like that happens, you're just like, oh, well, yeah, I know how to fix that because I've done it 20 times, or I know a fast, efficient way of doing it. And it was great meeting so many dentists because you would gain so much experience from them, just talking to them about different things. I was even on a course this weekend and we were talking about doing a trial smile. And he was saying, yeah, well, the key thing with a trial smile is when you first place it in, it's really important to block out the black triangles. And he said a key thing is you can get some orthodontic wax palatally and place that in. And then I said, actually, I've trialed doing those things. I find wax a bit fiddly. So I usually get a really small tip and then place it on the palatal. And I just use light body and just inject a very small amount just into where the black triangles are. Then use my finger to kind of smear it over so that I don't get any bulbous points. And then when you do your trial smile, you get a lovely trial smile. And then when you take it off, You can just tear all of the like body off in one go. And he was like, oh yeah, that's an interesting way. But it's great how we can all learn from each other and just little tweaks and techniques, because we're figuring things out. As dentists, we are problem solvers. So we're always trying to problem solve how to do things. And something that you do all the time and take for granted can be a real nugget for another dentist. So yeah, learning from all of those different dentists was great because you're picking up nuggets all the time. So it really helps your practice.
Well, again, I just want to highlight, and I'm not here to make you blush or anything, but I'm just, people always ask me for advice, right? They come to me, they see me, okay, Jaz been in the game a fairly long time, especially those who are, a couple of years qualified. They look up to me and then they message me, and I would love to point them to an episode like this and say, look, listen to Sam's got the playbook, right? Like, this is how you do it. And so I'm proud of you because, again, another thing that you exhibited is, again, you just said you were in a course this weekend, okay? Now, eventually that will stop because the season of life will change, right? And now you're doing more teaching as well, which is wonderful. It's a great way to learn. It's like the taxonomy of learning. When you teach something, that's when you really learn something, right? But you had to get to a certain level to be able to do that. I'm sure you would have had some imposter syndrome going for that. But having the faith and the guidance of Monique must have really meant a lot to you. I mean, I don't want to talk about money too much, but let's just face it that when you were doing an apprenticeship thing, right? Like apprenticeship post, am I right in saying that you could earn more as an associate than it just side by side, earning more as an associate than an apprentice? Would you say that's correct?
100%. Yeah, you take a salary cut. Even you'd probably earn more on the NHS than you would as an apprentice, but it's not. But then the experience is more valuable than any money.
So I've said this story before a few times, and if those maybe are new to the podcast, I was once in a situation where I got offered a very lucrative position on Harley Street. Or just out of town, really lovely principal in a fairly affluent area, but like it was day and night difference in terms of my future earning potential. Okay, but with one practice, it was there. I was going to learn a lot. It was very clear. The principal was going to be there. I'll shout him out, Dave Winkler, legend. He was going to be there. Okay, and I learned so much from him. Okay, and then the other Harley Street practice, I knew it would just be me on my own. Okay, and so I took the pay cut. When you are young, work to learn, not work to earn. And I just want to highlight, you got the playbook, my friend. You got the playbook. So well done. I think you make some great decisions. Hello, YouTube Protrusive. I know you're watching on YouTube, and I hope you're enjoying this episode so far. But I wanted to highlight, in case you don't know yet, we have an amazing viewing experience on protrusive.app, our website, our network, our platform. So I just want to spend a minute to show you what this looks like. On the left side, you see the navigation, and when you join the app, you get a 1-minute video tour of the entire network. Now, in terms of where the magic happens, that's in the Protrusive community, because you might come for the content, but you'll stay for the community of the nicest and geekiest dentists in the world. We have all these polls, we have a chat group, there's always active chats and dentists helping dentists. And really what I wanted to do is create a really supportive environment that's not like the environment we have on Facebook, and is built on the values of niceness and geekiness. If you are nice and geeky, you belong here. Now, to make this a safe space, we have a manual process of approval. We actually verify that you are a dental professional before you get in here. So we have hundreds of applicants a day. So if it's been about 2 days and you haven't heard anything, either something's in your junk or you need to reach out. If you're still waiting to join your tribe, email marie@protrusive.co.uk. That's MARI@protrusive.co.uk, and she'll investigate what's happened. Now, all the videos you have on YouTube are also on here, but you actually have some extra ones for free that you don't have on YouTube. So you get some bonus content that's not on YouTube. And actually for the future, I'm not taking things out of YouTube, but some things are not appropriate for the wider public, and I want to sort of safeguard that information, which is like dentist talk, if you like. So that's why a lot of the content is only here and not on YouTube. So you're kind of missing out if you're not on here. That's why I'd love for you to join there. And if you join one of our paid plans, then what you get is access to the CE quiz like this one, and you can get CPD or CE certificates, and also you get our premium notes. So these are a great aid memoir or revision for an episode to really cement your learning. And whilst we have ads and YouTube places ads on YouTube, we don't have that on our network. So for the paid plan, you get to see all of the premium notes without any of the ads. And of course, you get to support Team Protrusive and help us to continue what we're doing. I'm just going to gloss over the Protrusive Vault, which has all our infographics and downloadables. These are all our masterclasses at this moment in time, and we're always planning to add more. And if you look at them, there's about 1, 2, 3, it's about 7 of them. But actually, if you look at the replay section, some of the live masterclasses that I've done and some of the training that people pay for on other websites is all on there, included as part of the masterclass subscription. And And if you're a student, don't fear, we have a special section for you with all the student notes, which anyone can access. So for example, here is one on exodontia. So it's all there waiting for you on Protrusive guidance. Please head over to the website, which is protrusive.app. Make an account on your browser. This could be Safari, Chrome, however you want to do it. And once you've made your login, then you can download the iOS or Android app and then log in through there. So the reason to make the subscription primarily on the website first is that you get access to a free trial, which you don't get if you do make an account on Android, iOS. If you make it on the website, you get access to the free trial and you get our best price if you sign up through protrusive.app. So our best deals and free trials are only on protrusive.app. Of course, we always put the link below in the description. And thank you so much for enjoying our videos on YouTube. But it's now finally time to level up your experience. Back to the episode. Speaking of decisions, did you ever, because I see the trajectory you're going in, mate. You're doing some fantastic aesthetic work. I can see that it lights you up, okay, which is great. So people finding my niche. In fact, someone messaged on the app recently on Protrusive Guidance Community. I think it was James Murray. He said he's a young dentist, few years qualified, and he's feeling a bit nervous or unsure about the following thing, where he's like, I don't enjoy endo so much and I enjoy these things. Am I too young to drop those things and focus on this? And you know what? He's getting some wonderful advice on there from people like Sandra Hulak and stuff. It's like, listen, you do you, right? Yes, it's good to get your footing and as a young dentist, be good at everything before you choose to niche. But sometimes when you identified your strengths and identified your passions, it's okay to say, you know what? Dentures, I refer. Endo, I refer. And I'm going to focus on these 2-3 things. And I think that is really a key recipe to niching and flourishing. Even Pascal Magnier had a session with him recently. His advice to young dentists was, don't try and be good at everything. He actually said, just pick a few good things. And so I see that you're focusing, Sam, on aesthetic dentistry. It obviously lights you up. But did you ever consider with your physio background, you are in a great position to be that TMD guy, right? You could be the TMD guy, right? Because I refer so many of my patients to physio, especially Krina Pancha in London. We get far better results than alone. Did you ever get tempted by that path?
I did, and I did a few courses as well, because at Liverpool they have kind of physio courses on TMD. I think it was a similar struggle with Ben. So me and Ben were trying to put together a back pain course, and for those that don't know Ben, he is an extremely good physiotherapist and he deals a lot with chronic back pain. And he said, Sam, I don't know how you get the time to kind of do dentistry and do this, but I can't do my job and then help you with this big course. And the reason is because when he's at work, when you're dealing with chronic back pain, these people need a lot of help and they need a lot of kind of TLC. And pain is such a multifactorial component that is not just about the tissues, but it's also about their psychosocial
well-being.
Well-being, yeah. And some of these people have had really traumatic pasts that you almost need to help them with to get over the pain. They say, you shouldn't take your work home. You can't not take that home. And I felt that there was a very similar pathway with regards to that and TMD. And I think hats off to any dentists that deal with patients with TMD. But I just felt like I probably wasn't the best person to deal with that.
I think you're very intelligent, my friend. I'll tell you why. Look, you said hats off. I'm living that at the moment. There's a reason why I've limited my TMD days to Mondays only. Like, I only do TMDs on Mondays. Because you're so right. Like, I was sat next to someone at the BACD conference, right? And he's a young dentist and he was there with his partner. And she was a therapist, like a psychological therapist, right? And she told me that all therapists have a therapist. And I'm like, oh my God. Immediately, I was like, I've never resonated with someone so much because we were talking. I was like, oh my God. Like, and you're so right. TMD patients need that TLC. They need that whole holistic package. And I could tell you some really sad stories. And obviously I won't for patient confidentiality. And, it does affect me. Psychologically, it does affect someone. And so it takes a certain type of person. And I appreciate where Ben's coming from that, dealing with chronic pain patients takes its toll on you. So what I've done is create some boundaries. Like, I only do emails on Wednesdays to my patients because I just can't deal with chronic pain emails every single day. I can't. It would just break me. Okay. I only see a TMD patients on Monday. So I've set boundaries to be able to help these patients, but also make sure it doesn't affect me and my family and my mental well-being. And certainly I see therapy being part of my future as well. So I think you're a smart cookie. So if everyone's wondering why I didn't go into that, I respect that and I appreciate that because it needs to be right for you.
Yeah, exactly. I remember last time we were talking about the different books that you read and a lot of the self-help books. And there's a reason why I think dentists go into that, because our lives are so fast-paced. We're seeing lots of patients. but also we're living in a 21st century environment which our genes and our brains just aren't geared for. I'm living in London now, and walking past like, hundreds of strangers every day, that's not normal. 10,000 years ago, before the agricultural revolution, when everybody was hunter-gatherers, you'd be living in a tribe and you'd know everybody. And there's a reason why like people want to be famous and things in societies, because back then, everybody knew who you were. So then people want to be famous because people want people to know who they are and things. But yeah, it does take it. I think subconsciously it does take its psychological toll. So I always think, if you want to be stronger, then you would get a personal trainer. So why would you not get a therapist to help with your psychological well-being, that's not going to just help you with problems such as, family traumas, or if you're depressed or something at the time. But why not get them when you're feeling normal, so that they can help maximize how you can live and how you can use your brain? Because your brain is a tool, and a lot of therapists can help you unlock that tool and help you become more resilient, especially when you do face challenges in the future. I don't know what you think about that.
Totally. 100%. We had Maruk Khwaja on the podcast as well. We had Simon Chard recently. They said, we need to put the prevention back into mental health, especially for dentists. We do such a tough job. So to try and get some regular mental toughness, resilience training is totally worth it. Now, I'm going to make a little analogy, right? When Cristiano Ronaldo rejoined Manchester United for a second spell, there was this famous thing I remember reading where all the other players, they stopped like eating what they were usually eating. They'd all look at Ronaldo's plate, right? Because they're like, okay, I want to be like Ronaldo, right? So I'm going to make this comparison that you are the Ronaldo in a way, because you have this edge, okay? You are the Ronaldo of posture and physio of dentistry, okay? So you own it, my friend, own it, okay? Because you're so much more than that. But in this realm, like, I'm going to be looking to you like, okay, what's Sam doing with his posture? How's he sitting in his clinic? Okay, because whatever Sam's doing, I want to be doing that. Because you can't unlearn what you've learned. You can't unlearn the years of physio. I'm sure you treat your body like a temple. How many times a week do you work out?
Usually like, yeah, 3-4 times a week.
You look in great shape. I'm sure you do more stretching than the average dentist, etc., etc. So let's talk about best practices, right? So let's start with am I naughty if? Am I naughty if I make an expensive purchase of Ergo Loupes in the promise from the marketing that it will help my neck pain stroke back pain? What's your stance and analysis of these ergo angled loupes?
I love them. I've got Ergo Loupes as well. And I think having ergonomic loops is great because you're sat in a position where you're having the least amount of muscle strain. And I find it a lot more comfortable. Now, some people might not find it comfortable, but I'd say probably in the majority of people you would. And the reason is because when you are doing longer procedures and you're looking down, you're going to be under a bit more muscular strain than usual, and you might not be able to hold that position for as long. I think the key thing is that your body is completely adaptable. So if you train your body to do something, you want to train your body to hold your arm out for, 4 hours, you can train your body to do that. If you started to do it straight away, that's going to feel uncomfortable. If you've spent your whole life with a certain loop set and you've had your head over a patient, you can train your body to hold you in that position and not get uncomfortable.
I've never thought about it that way. It makes so much sense. Because the thing I was going to add here is I was skeptical about when I made the switch to Ergo Loupes. I was skeptical, right? But when I started to wear them, okay, I didn't feel immediate benefit. I'll tell you why. I didn't feel immediate benefit because then when I put my Ergo Loupes down and then I went back to my normal loupes, that's when I felt like, holy crap, my neck's on fire. Do you see what I mean? Because exactly, I'd adapted to that. It's a bit like going from somewhere like, hot to warm and then hot again. And then, whoa, now you feel that heat basically. It's a terrible analogy, but like, yeah, I only felt it when I had that neck declination again with the normal loupes. And now I very much prefer my Ergo Loupes. Obviously, I'm sure there's no double-blind trials, systematic reviews on this because it's a difficult thing. It's a bit like musculoskeletal. It's like a difficult thing to study. But I think the message is, if it feels good to you, okay, then do it. But I think musculoskeletally, it does make sense, doesn't it?
Yeah, I think the basic principles are research to kingdom come. We know that the stronger you are, the more able you are to be in one position. And I think you have to take those principles and then apply common sense to those principles. It's like there's no double-blind research trials to say that jumping out of a plane with a parachute or without a parachute. So if we can, apply common sense to these things, maybe we don't need, it's only anecdotal evidence that jumping out of a plane with a parachute is actually beneficial. But yeah, I mean, everything is about muscle adaptivity. Like, if you look at a cyclist, if you look at their posture, like that flexion posture and that head tilt up, you would argue that is a terrible posture.
Same with hockey players. Also, hockey players. A few times I've tried to play hockey. I was like, what the hell's happening to my back? I don't want to play hockey anymore.
Yeah, but and also if you look at a chimp's posture, terrible. Like if you were looking at that kind of Victorian ideal of how posture should be, because I think posture in the past has always reflected kind of status and like, sex appeal. And then it's kind of been linked into this is how you should sit because this is good for your pain. But sitting up in an upright position with your head in a certain angle, or even standing up in a very upright position can be comfortable for some people based because everybody's back and the way that people sit and stand are very, very different based on their own anatomy. Some people might find it extremely comfortable. Some people might find it extremely uncomfortable. So it's about figuring out where you are on that spectrum. If it feels really comfortable to sit up really straight, then doing that. In terms of the Ronaldo play, I don't care about what posture that I'm in. And the reason is because there's lots of long-term trials that say that if you do care about what posture you're in, it creates almost a fear of what posture you should be in. And therefore, you actually end up being in more pain.
I'm getting deja vu. I'm getting deja vu from our episode 270 episodes ago. I think you must have said the same thing because I then made the exact same comment. There's like patients obsessing about their occlusion, right? And how their bite feels,
Exactly that. Yeah.
Okay, that's very fascinating. So it makes sense to have ergo loops. I get it. Okay. And it's amazing what you talk about. You can train your muscles to adapt to a certain posture. I think you made that point really well. What about these Bamback chairs? And I think Bryant have got this Nobad or something, Nomic or whatever chair as well. Are they worth it? They're not cheap. So ergo loops, I think, is a big tick from Sam. Where do you think about these posh chairs?
I think with these chairs, in terms of the trials that are out there, they say that it can improve your posture, whatever that means. So it can put you into that more ideal posture. Whether that reduces or even increases pain is set to debate. But in terms of are they good for you as a dentist, that will solely depend on your own anatomy and the positions that you prefer. The crazy thing is, if you believe that it will be good for you. You will almost train like the same way with your Loupes, Jazz. If you train yourself to sit in that position, eventually you'll get to a point where you don't want to sit on any other chair but a saddle chair or one of the Bryant chairs because you've adapted to that chair. Whereas you can adapt to other chairs. It's just trying to figure out which one is the most comfortable for you. And people hate this because I'm not giving it one size fits everyone, but it's because there isn't really. I mean, that's why with dentistry, we've got millions of TPs because there isn't one size that fits everything and it can change.
So if it feels right to you, get it. But maybe if you're happy in your chair and you believe your own chair is working, then, it's fine as long as you're feeling good. But perhaps if you're looking for change and you're going to buy one of those chairs and you can also make that work, the human body is very adaptable. But would you say that someone's absolutely fine? Like, I don't get much back pain, touch wood. I don't at the moment, okay? And so would it make sense for me preventatively, as a strategy to improve my career longevity? Would it make sense? I mean, obviously we'll never know because you don't have evidence for that. But what's your gut telling you?
In terms of my gut, I don't think it would make a massive difference in terms of what chair you were going to get. But if you wanted to try them out, I think it's a great idea. You might find that once you sit in it, you feel more comfortable. So I'd probably recommend when you're at one of these dental shows, go and sit in one of those chairs. And if you feel like, wow, this feels really, really comfortable, then I'd say for you, yeah, get it. But if you went to one of those shows and you sat in the chair and thought, wow, I feel really strange in this position, then it's not to say don't get the chair because your body will most likely adapt. But you might find that it takes a bit of time to kind of get used to it. The same way as if you went from using ergo loops to go back to your loops, you would get used to it. Like you said, you get that kind of bit of burning pain in your neck, and all that is muscle fatigue, but you would get used to being in those positions. So yeah, that's what I'd recommend. I think it's just taking everything on an individual basis because every single person's back and neck is completely different to the other person's, just in terms of how it all works.
And so before we pivot then to some aesthetic dentistry type stuff, I just want to then tackle that unfinished business, right? So overall, we're suggesting, okay, if a chair feels right, go for it. Ergo loops probably will help you. But what are your top 3 bits of advice that you want to give to dentists that you follow that perhaps we should be doing more to look after our bodies that maybe with a physio hat on help us prevent back pain in the future? How can you guide us? Because we made that bold statement that posture and back pain are not really well correlated, a bit like occlusion and TMD is not well correlated. But in some individuals, it could be the cause, and some individuals, bad posture could be the cause of their back pain. I think you mentioned about acute and chronic. Do you want to just talk a little bit about that?
Yeah, I think in terms of what we were talking about last time and this time, with posture, say if I was in, I was doing a difficult procedure, say I'm quite stressed, I'm doing a composite veneer procedure, it's taking about 3 or 4 hours to complete, which sometimes they do. I've seen dentists take 10 hours doing a 10 unit case. Say if you're doing that procedure, you start to get a little bit stressed. You're kind of in a position that is unnatural for you. You've got your head down and you're in that position where you're putting a lot of strain on your muscles and you get some pain from that. Then if you were to get some back pain and the next day you wake up and you've got some back pain or you've got some neck pain, then there's specific things that you can do to help that. I think the key thing, firstly, don't worry, because there is a massive, between feeling pain and actually getting an injury, there is a massive kind of space between that. Your brain is very, very protective. It's almost like a very sensitive car alarm system. So the alarm will go off before it causes injury. Because evolutionary, it wouldn't make sense for you to get pain once you've given yourself a serious injury. So firstly, like if you do start to feel pain, then that's what I do. And we can delve into that a little bit more later in terms of what to do with acute, and then we can delve into chronic pain. In terms of preventative strategies and what I do.
I think, Sam, let's talk about prevention, because in that episode we did with Ben, actually, yourself and Ben, we talked a bit about just chronic pain and the science behind that as well, and how your best posture is your next posture and motion is lotion, all those wonderful things we talked about. So I maybe talk about prevention before we pivot to some of the composite veneer stuff. So tell me about prevention.
Yeah, so in terms of prevention of back pain, all the evidence is geared around exercise, almost everything, even though there is evidence to say that some postures can be more uncomfortable for others in dentistry and for different things. It doesn't really make any sense, because we did a survey a while ago looking at dentists in Liverpool, and we found that almost like 30 to 50% believed that having a good posture would prevent you getting lower back pain. That just simply isn't the case. Because let's take the common sense principle again. If you want to be in a position for a long time, your muscles have to be very conditioned to do that. If I said to you, like, oh, you're going skiing next week, you wouldn't be practicing your posture. You'd be practicing, you'd be doing squats against the wall. You'd be kind of getting your legs conditioned. If you're going to do a sport, you're going to want to condition your muscles to be ready for that sport. And that's exactly the same for dentistry. You can be in those long positions. You can sit for more than 30 minutes and it's not a problem. You just have to condition yourself for that. So say if you are a student and you've not really done any long procedures before, and then you go into doing dentistry and all of a sudden you've gone from being on your summer holiday to then starting your foundation dentistry, and all of a sudden you're seeing 20 patients and you're sat on the chair and you're a bit stressed, you are much more likely to get back or neck pain because you're just not conditioned to do that. But after a period of time, after say, a month or two or something of doing it, it'd be much less likely for you to get back or neck pain because you have conditioned yourself to be in that kind of routine. And that's the same with the gym. If you were conditioning yourself and you were started to do, 100 kg squats or something, and then you took a 6-week break and then you went back to doing those same squats with the exact same weight, you're much more likely to injure yourself doing that. And that's the same from if you were going from lots of short procedures and then you decide, actually, I'm going to start doing more composite veneers, and you spend 3 or 4 hours doing a composite veneer session, you're more likely to feel a bit of pain because you're just not conditioned. So I'd say in terms of what I do, if I do start to feel
Go on,
pain,
Ronaldo, what'd you do?
I'm just thinking like, what has caused that pain? What's going on? But then in the gym, all I do is I just do normal kind of exercises. I'm doing running and things a couple of times a week. I'm just doing the exercise that I enjoy.
Because I've heard on like random BDA posters that Pilates is supposed to be superior, and recently Simon Chard came on the podcast and he said deadlifts. He's actually recommending deadlifts for dentists. He's saying that's good, but he's not a physio. So I'll take you're the Ronaldo of it. So what do you think about deadlifts? Should we be doing deadlifts? Or because I know some dentists who avoid deadlifts because they don't want to mess up their back for dentistry. But actually, should we be doing deadlifts to sustain what we do?
Yeah, I don't see why not. Yeah. I mean, it's just keeping yourself strong and keeping yourself active. You could do deadlifts if you want to, but some people don't like going to the gym. And especially when I was at uni, I know a lot of girls didn't really like doing deadlifts because sometimes they're in like the kind of the weighty male section of the gym and they feel a bit intimidated.
Or that grunting.
Yeah, yeah, yeah. So like it's just doing the exercise that you enjoy. If you're doing lots of if you're doing lots of running or if you enjoy that or swimming.
It's a concept of gamifying, right? It's gamifying your exercise and actually fulfilling and enjoying it. I think you've hit the nail on the head, because if you do stuff because Jaz or someone said in a podcast, or do deadlifts, and then you don't really enjoy it and it's awkward for you and it doesn't really work out in your schedule or your environment, then it's not going to be applicable in a daily world. You can't make a habit out of it. But if you love swimming, you absolutely love swimming, okay, and then you can take your kids swimming at the same time, whatever, and it works in your life, then that's the way to go, right?
I think a good analogy is if you are sat down for a long period of time, imagine if you've got a machine and you're keeping it still for all that time, or even when you are still, you can find that, when you pass, you can click your fingers or you can click your neck because you've kept still for that amount of time. So with a machine, you would oil the machine and that would help lubricate the joints. And you can do that with your body just through exercise. When you run, swim, do deadlifts, you will be compressing the spine. You will be releasing synovial fluid. You will be lubricating your joints. You will be getting everything supple and moving.
Motion is lotion, once again.
Exactly. Yeah. But yeah.
Well, I'm really pleased we covered all the back prevention stuff. That's a lot of the CPD questions for this episode will be linked to that. But I know one of your passions is composite veneers, right? And then you mentioned about using stents. So let's just pivot to that. So I think just to summarize previously, Ergo Loupes, great. Chair, see how it goes for you. You made some great points about muscle adaptivity and making sure that as dentists, the most important thing we can do to protect our longevity is make sure that we have exercise. And I think it's something that we all know, but sometimes hearing it like this, people, like one of my good buddies messaged me saying, look, I'm really out of habit. Everyone says I need to get back in the gym. And it's about actually taking that action and getting to it. And that could be gym for some people. It could be playing basketball for some people. It could be whatever it is. But making sure they have that exercise regime, and that will support them having a long career, because it means your muscles, your core muscles are conditioned and primed to do what we do, which is very challenging physically, right? But you mentioned composite veneers and how that can take its physical toll on you. And I think you mentioned about using stents. So different ways of doing composite veneers, freehand. Then there's different, the smile fast kind of ways. Then it's injection molding. What kind of techniques do you like? Case by case, obviously it varies, but what are you favoring? Well, there we have it, guys. Thank you so much for listening all the way to the end. This one is eligible for CPD or CE credits. We are a PACE approved provider. And if you're watching the podcast on the app, Protrusive Guidance, just scroll down, whether it's the web app or the actual mobile phone app, and answer the quiz. If you get 80%, you can get your certificate emailed to you by our CPD queen, Marie. And interesting, on the chat the other day, Ben, who used the app a lot, and I see him on our little community, almost 4,000 strong community that we have on the app. And could be way more than 4,000, but I try and keep it within the podcast because I really want to attract the nicest and geekiest dentists in the world. The quality of the dentists that we have on our little platform is far more important than the quantity. And so what Ben said was that he didn't actually know, he wasn't aware that there are premium notes for the episodes and there are transcripts for the episodes. So all these episodes, we have like a cheat sheet you can download. And the way we're sort of redesigning the cheat sheets now, or the premium notes as we call them, is we're going to have a PITC section right at the top. So what does PITC stand for? Okay, it stands for patient in the chair. So this part of the notes is basically, you got a patient in the chair and you urgently need something from the podcast. You remember listening to a really important gem that's going to help you with your patient that's in the chair right now, and you need to find that piece of information. I know that people have done this before when they have a reservoir and bridge to fit and they're frantically going through my reservoir and bridge course before they fit that bridge. And so in the same vein, PITC, the patient in the chair, I'm going to give you the top 5 or 6 most actionable tips right at the top from all the future notes, including this one. Obviously, it wouldn't be relevant for this one because you wouldn't have like a patient with back pain in the chair. It's more to do with you, but you get the idea. It's a new thing that we're starting, but all the episodes of the past have got premium notes and transcripts, and some of you absolutely swear by them. Shout out to Kostas and Harpradeep, who've been absolutely pivotal in our little community. I know you guys enjoy the premium notes and the transcripts. I want to take a moment to thank all the team that are responsible for this episode. That's Jan, Chriselle, Nav, and of course our CPD queen, Marie. And thank you once again, listener, watcher, whether on YouTube or on our very own app. I really appreciate you. Thank you so much. And do not miss the next episode. The next episode is just full of so many gems. It's a short but punchy episode on composite veneers, and namely how and why Sam does not like the flowables like a Genio injectable for composite veneers. He likes to use the paste compule. Find out which exact brand that he names drop, and they're different companies, right? Different companies. He names drop these brands, which ones he's using that he's tested and are suitable for injection molding. That's right, compule composite, not flowable, compule composite for injection molding. What kind of stents he goes for, who makes the best stents in his opinion, because Sam himself has been on so many courses related to injection molding and composite veneers that he shares everything. He gives away so much. So tune in to the next episode where we pivot with Sam more into the composite veneers theme and a really interesting story of how things didn't go to plan and what he learned from that and the lesson he wants to pass on to us. So don't forget to hit that subscribe button so you get notified for the next episode. I'll catch you same time, same place next week. Bye for now.